pangalan niyo, Doc?
Good afternoon to all of you. On behalf of the Philippine Society of Venereology, would like to thank the Philippine Academy of Family Physicians for inviting us to share our knowledge on sexual health and allow me to present and discuss to you and to journey with me as I do the lecture on the sexual history. I titled this as Sexual History Taking as an Art. Our objectives for this session are the following: to comprehend the skills on how to do sexual history taking, rationalize the challenges and the barriers in doing sexual history taking, create non-discriminating question, maximize the opportunity to educate the patient on other sexually transmitted infection, including issues and concerns, as well as the risk of contracting HIV. All information that I'll be sharing with you came from medical books, articles, journals, and personal experiences. The biopsychosocial model adopted from Wiley KR in 2015, I would like to emphasize that this model provides a comprehensive holistic framework taking into account the medical, that is the biological, the psychological, the interpersonal, and the social and ethnic variables that may affect sexual health and function. This is essential to identify the predisposing, precipitating, maintaining, and contextual factors responsible to the presenting signs and symptoms of the patient. Our patient in our clinics, we need to treat not only the patient who comes in, but we need also to treat the partners if possible. These are the array of patients that we see in our clinics. A woman who thinks and feels just like a man, pwedeng sabihin nating lesbiana, and the partner who is a man who thinks and feels just like a man, so straight, so pwede sila. The second thing, the second partners na or couple na masasabi natin is a woman who thinks and feels just like a man or a woman, so bi na tinatawag natin. And the partner is a woman who thinks just like a woman, so talagang straight, so pwede sila. Another couple that I'm presenting to you is a man who thinks and feels just like a man, so straight, and a man who thinks and feels just like a woman, so yan yung tinatawag nating MSM. So yung isa ay pwedeng lalaki, yung isa ay pwedeng babae. And then the fourth couple I should present, the fourth couple that I'm presenting to you is a woman who thinks and feels just like a man, tomboy, and the partner is a man who thinks and feels just like a woman and a man, so bi. As you can see that these patients who are coming to our clinics are really complex, and it needs what? Skills how to deal with them. It is not always easy, as I've said, to get information from them, especially when you are asking their personal and very private information. It depends on the ability of the doctor to combine both the medical history as well as the patient personal history. And of course, if you combine it well, then it will be easier for you to arrive to a correct or accurate diagnosis. 75% of your time is dedicated in doing the sexual history, and the rest will be dedicated to physical examination. The first 2 minutes is very important in building rapport. As you as as we notice, the moment that the patient comes into our clinic, that's the beginning that the patient is also doing an assessment of us as doctor, whether we are compassionate or we are loving or we are caring. And at the same time, that's also our opportunity to assess if the patient is speaking Tagalog or welcoming to us, or even maybe terrified because this may be the first time that the patient sees a doctor. So importante po yon. There are barriers in doing sexual history. The first one is the cultural background. As we all know, Filipinos are not used to hear the genitalia words, just like the titi or the pek, and sometimes these words are only for bedroom consumption. And in a family, of course, we don't hear it right away. We just hear this when we are teaching our children, or even when we were still small. But in the common language, we don't hear this. And against the Western culture, they are very open when we talk about vagina, the penis, the breast, and others. The second barrier is the sex differences. If you are a male doctor and your client is a male, sometimes it's very awkward to discuss matters related to sexual practices, behavior, and even what are the sexual toys that this patient are using. So mahirap din. Hindi rin porket lalaki kami and then yung lalaki ang kliyente, komportable, hindi po. All the more when we have female clients or female patients, mas mahirap. It's very hard to start with what is your sexual preference, what is your sexual behavior, and how often do you do it, mas mahirap. So, in other words, doing sexual history, sometimes it may lead to embarrassment, or sometimes either the doctor or the patient may also be frustrated if at the beginning you did not connect. The third bullet, the third barrier is it is time consuming. No, it's just like a Pandora's box. So when you open one information, you need to open another information because this information are interconnected. There are unfamiliar and sexual terms that the patient may inject during the storytelling time. And it's very awful or awkward for a physician if you do not know these terms. And most of the time you will be saying, can you explain this term to me, please? Or hindi ko naiintindihan, pwedeng pakiulit. If you repeatedly saying these questions to the client, definitely it may lead to frustration, and the trust that has been given to you may dwindle. As I mentioned a while ago, that building rapport is very important in the first 2 minutes. In this COVID time, we seldom do the shaking of hands, and most of us would do the greeting just like the Japanese, or the bowing, or even put our hand on our chest. And it's very important also that we should say kamusta, kamusta ka, and kamusta ang buhay-buhay, especially in this COVID time. And as a doctor, you need to offer your service. Pwede mo sabihin sa kanya, ano ba ang pwedeng mapaglingkod ko sa, anong pwede ko bang maibigay sa iyo? How can I help you? Ano bang pwede kong maitulong sa iyo? When a client, when a patient uh, when a patient hears all of this, definitely sasabihin niya, mabait yung doktor o very compassionate yung doktor kahit hindi ka pa nagsisimula, because the way you treated the patient is already a sign that you are caring. all data, all information that will be given to you as a physician must be handled very well under the umbrella of confidentiality. Remember, we are digging into the private lives of individuals. We are digging into their sexual preferences, sexual practices, and even their sexual acts. Now, all of this will be related in giving the right diagnosis. Sexual history must be done during initial visit, routine preventive examination, these are the follow-ups, or even when the patient presenting signs and symptoms of sexually transmitted infections. All of the dialogues that we have will lead to an opportunity of risk reduction counseling that eventually will also lead to behavior modification. The ultimate goal of this, it's not only treating the patient, but we also want our patient to do some behavior modification, particularly if they are doing risky behaviors. As physicians, we must have these attitudes. We must use the language of the patient. When the patient comes in and if you say, kamusta ka? And the patient answer back, okay naman doc, which means the patient is speaking Tagalog. And when you greeted the patient, kamusta ka? And the patient answer back na, I'm okay, doc. How are you? Which means the patient is English speaking. So kung Taglish naman, then that would be easier for us. But when you say, kamusta ka? And the patient comes in and answered you back in her own dialect or in his own dialect, then definitely it will be very difficult for you because some of the terms that you will be hearing will be in their dialects. So pwede mo sabihin sa kanya na as we do our sexual history taking, can we speak in Tagalog o pwede ba tayo mag-usap sa Tagalog kasi mukhang hindi ko maintindihan yung ibang terms. It is okay to say kung hindi mo naintindihan, please tell it to the patient. And I think based on our experiences, the patient usually, okay po doc, magtatagalog po ako as much as possible. We need also not to be judgmental. The way we formulate our question uh, must be not incriminating or it's just a plain or neutral. We must also accept the responses of the patient. We should not doubt. Wag kang maging, oh, come on. Well, hindi po pwede. Really? Parang the word really, oh, come on, these words mean something else. So you're doubting. So it may lose even the trust of the patient to you. So no, the curtain will be falling down. The next is about courtesy. These patients, especially the sex workers, you need to show respect, and they are also human being. So the moment they come in, you need to show respect and do what you are doing to the rest of your patients. Hindi pa pwedeng naiiba sila. So importante po ito, especially when we are dealing with this kind of with this kind of people, the sex workers. There are also challenges that we are facing in doing sexual history. Since it's very personal, of course, mahirap po, hindi po madali na natanungin natin ng pasyente, ano ba ang sexual preference mo? Lalaki ba? Babae ba? Parang it's not the usual thing. And it's also a challenge for doctors. And there are doctors who are not comfortable with it. Mga doktor din ayaw di matatanong about these things. Pero tayo tinatanong natin mga pasyente. So we should be very careful and we should be very skillful in terms of creating even the questions na sinasabi natin sa kanila. All of these things, it will either make or break. Pag nagkamali ka na sa pasyente, definitely your history taking hindi maganda. But if you during from the beginning up to the end that you have shown respect and courtesy, then you will be having a very good sexual history taking. There are terminologies, just like I've mentioned. Like, have you heard about Greek pie? Hindi po ito nabibili sa bakery, but this means that when the semen visibly drips out of a vagina or anus after ejaculation during sex, so tumutulo po out of the vagina. We also heard this terminology from patient Dirty Sanchez. So this is an act where someone puts their finger into their partner's ass and their wipes and fecal matter that may transfer onto their finger over the person's lip, resulting in a poops mustache. So parang yung poops andyan dyan na sa bigote. So they have these are part of sexual gratification. Edging refers to delaying an orgasm for as long as possible with the goal of having an ultimately more intense climax. And also, have you heard about motorboating? Okay, ito po yung your face being placed between someone's breast and you're moving it up and down quickly while making a raspberry sound when or where your tongue and lips really doing the sound. So parang like a motorboat. So pearl necklace, hindi po to nabibili sa Green Hills. Hindi rin to nabibili kahit saan. These are the semen, no, drops of semen that are said to look like individual pearls on a strands of beads sa neck po. So they allow the semen to drop, no, dito sa along the chest where you see the necklace. So para siyang pearl necklace. And also the another terminology that I want to impart to you, the rusty trombone. This is not an instrument, but rather this is an act of performing a simultaneous rimming and doing masturbating. So ito po ang some of the terminologies that may also increase your vocabularies doing sexual health, sexual history taking. These are sample dialogues, the doctor speaking to the patient. Okay ba na magtanong ako tungkol sa sexual behavior, sexual preference, o sexual practice? Kailangan ko ito para malaman natin ang iyong kalagayan at makakaasa ka na ang lahat ng maririnig ko mula sa iyo ay sa akin lamang at pag-iingatan ko to. So in this particular questions or statements, makita mo na you are offering already the confidentiality. And as you begin, no, you ask permission kung okay ba siya na tanungin. That's one way of respecting the person. Another thing is ang lahat ng mga tanong ito ay tinatanong ko din sa lahat ng pasyente na nagpapatingin dito anuman ang kanilang edad, kasiraan o may asawa o wala. So all questions that you are trying to ask sa iyong patient are also the same list of questions that you are using when you are doing your sexual history taking. So ibig sabihin pantay-pantay, hindi siya naiiba. No. So with this, the patient may little by little give his or her trust to you. Meron ka bang gustong itanong at pumapayag ka ba bago tayo magsimula? So this particular question, so kino-conclude mo na pumapayag siya to have the question and answer or even the storytelling portion about things related to his or her signs and symptoms. These are the constructions of questions. Sometimes we use this, and dapat hindi natin ginagamit because it's labeling already. Are you married? No, and it is better to say what is your current relationship status, and you're married, do not need an STI testing, right? So, na-label mo na siya may asawa. But the more acceptable way of asking this, have you had any new sexual or any new sexual partners or a new sexual partner in the last year, more acceptable yon. Do you think your partner is cheating you? So hindi pwede natin gamitin ito. We can use this. Does your partner have other partners? So hindi masyado siya incriminating. Do you sleep with a lot of people? Although we want to establish whether your patient is having multiple sexual partners. So we can ask this in a better way. How many sexual partners have you had? Or if we are thinking that our patient is a drug user, are you an IV drug user? Of course, we will not use this question, but rather we will use this or ask in a better way, have you ever injected drugs? All these acceptable questions will also help us to get more information. The transgender nowadays, we see men dress up like women, we see women dress up like men, and we should be very careful dealing with these people because somehow hindi naman sila part ng norm. So when these people come to your clinic, you must be extra careful, particularly in asking question. You may ask the question how or she wants to be called for or addressed. Importante po yun. Perhaps a man dressed up like a woman, that transgender want to be addressed like a woman. So she ang gagawin ko. Or perhaps that woman has a name. Imbis na Marco, ang tunay niyang pangalan, ang gusto niyang matawag siya ay Martha or Maria. You may also ask the names, no, for the names of the body parts. These men who have undergone surgery, malalaki na yung mga breast nila o yung suso nila. So they have special name for those body parts. So you may ask them. As the sexual orientation or gender, ito po, for a transgender, they want to be called women already. For women who have been dressing up like men, they want to be called men. And sometimes their partners, we need to also be very careful asking their partners. Pwede kasing pareho lang, transgender. Minsan hinahanap din nila. Or sometimes, kung man dress up like a woman, no, ang hinahanap niyan ay lalaki. So transgender may be of any sexual orientation and also part of the challenge that we need uh, overcome, or rather to find ways to have better information coming from them. The 5 P's focus on sexual history are the following. So when you do your SH, you must focus on these areas: the practices, the sexual practices, the partners, the whether regular or casual, then the protection from sexually transmitted infection, and the pregnancy, the prevention of pregnancy or the intention of the person to have a child in the near future, and the past history of sexually transmitted infections. We have a case here at 25 years old, single male, an office worker suffering from penile discharge 3 days. He is a smoker and an alcoholic drinker. What are the clues based on this information? We can say that he's young, 25 years old, aggressive, no, and engaging in sexual acts, presuming we can label him as sexually active. And because of the discharge, this person did not use condom. He may not be using condom, or baka yung time lang yun, hindi siya gumamit ng condom. Your working diagnosis at this time is already too low, or the microorganism is Neisseria gonorrhea, and the patient may have also other sexually transmitted infection. All of these things, all of these clues, hindi mo pwedeng sabihin ito sa patient kasi sa iyo lang yan. Meron ka nang iniisip about about your patient. And these are the helpful questions when you are trying to get some sexual orientation information and activities. You may also ask, what type of sex do you have? So pwedeng vaginal yan, anal yan. Pero pag sinabing anal sex, you must also qualify it whether insertive ba siya. Are you insertive or receptive? When we talk about insertive, you're the one, your penis is inserting into the opening. Receptive, you're just receiving the penis. Pwede din bottom or top, no? Meron din tayo high or low. So these are the terms that we need to be oriented or familiarized with. And also we need to ask, can I ask about your partners? If the patient would say no, then you need to strategize how you can get information of the patient's partner. If hindi pa rin sarado, then you may further elaborate it by saying, I need to get some information about your partners so that I can treat you well, so that we can arrive to a better diagnosis. Kung ito ay infection coming from your partners, when I treat you, I need also to treat your partners. If you explain this very well to the patient, perhaps that patient or your patient will give you more information, or he may start giving you information about his or her partner. What do you think of condoms instead of, are you using condom? Definitely, it's so incriminating. So it would be better to say, what do you think of condoms? Ano ang palagay mo sa condom? Ano insight mo sa condom? And in this way, you are checking already the usage of condom sa pasyente. These are the sample questions where we want to know about the patient partner or partners. We don't use this question, are you having sex? It's so incriminating and discriminating. Parang nililabel mo na siya na nagsisex siya kahit saan. But rather, we may say this in a very nice manner, are you currently sexually active? No. If no, have you ever been sexually active? Then we use the months as reference. In recent months, how many sex partners have you had? So we're now establishing the number of sexual partners. Kung sinabi natin one lang po, sinabi ng patient isa lang po, then we extend it to a year. In the past 12 months, how many sex partners have you had? So in this case, you are now establishing the number of partners, because the more partners your patient engaging, the higher the risk that your patient will have sexually transmitted infection. It's not only one, but it could be one or two sexually transmitted infections. Are your sex partners men, women, or both? Usually in our clinics, ito po isa sa pinakamahirap kasi this will be the revelation. Pag tinanong mo ang pasyente na ang compartment mo ay lalaki, babae, or both, most of the time the patient will say, kung lalaki yan, sasabihin niya babae. Kung babae yan, sasabihin niya ay lalaki. O seldom that you will say pareho. O minsan hindi naman nila aaminin because they're trying to hide their sexual preference. But it's, of course, it's the manner how you throw questions. And remember, your question must not be incriminating. If a patient answers both, repeat the first two questions for each specific gender. So kung babae, you go again, in recent months, ilan babae ang nakasex mo, in the past 12 months, ilang lalaki o babae ang nakasex mo. If a patient has been sexually active in the past, but is not currently active, so tinatago niya na hindi siya active, it is still important to take a sexual history thoroughly. These are also the questions when you are investigating the practices of the patient. No? I will be explicit with my questions. So binibigay mo na sa kanya na mas detalye na po ako when we talk about the practice. What kind of sexual contact do you have or have you had? Pwedeng anal, vaginal. Yung penis in the vagina, that is the vaginal, no, or the genital. When we talk about the anal, penis in the anus, and oral touching the penis or the mouth to the penis, vagina, or anus. These are the practices because there are other sexually transmitted infection. When these practices are being done by our patients, we can identify specifically and we can treat the patient correctly. These are also the questions that we are trying to ask in terms digging into the protective measure of the patient or even the preventive measures. Do you and your partner use protection like condom against sexually transmitted infection? Gumagamit ba kayo ng condom? Or pwedeng you can go back to what we have learned kanina na in a manner na what do you think about condom? What are your insights about condom? So, and then you can proceed to this question. Kung gumagamit siya, papaano? And sometimes we ask if the person is a man, and then the man and your patient uh, uh, boldly said to you that, opo, gumagamit ako ng condom at marunong ako. We also check how he used the condom step by step. Because perhaps pwede niya sabihin na I'm using a condom, pero in reality, hindi siya marunong maglagay ng condom. O gumagamit nga siya pero mali. No? And also, kung ayaw niya gumamit ng condom, it would be very nice to ask, bakit? Bakit ayaw mo gumamit ng condom? So this will also clarify some myths, and misconception about condom na pwedeng nasa nasa brain niya na o nasa mind niya na ever since kasi because of cultural. And this is also the best time for us to educate the patient about condom use. And at the end, we may say that do you have any other question on STI? Then this is also opportunity for us to shed light on other microorganisms under the umbrella of sexually transmitted infection. Okay, for the past STI history, we want also to establish whether the patient had been tested on HIV or even other diagnostic tests. So, have you ever had any recurring symptoms or diagnosis? Or going back to the first one, have you ever been diagnosed with an STI? So, kailangan when and kung nagamot ka ba? Kung nagamot ka, natapos mo ba yung antibiotic? Pwedeng binigyan ka ng gamot, pero nakaisa o dalawa ka lang tableta. It's very important to take note whether the patient has completed the medication. So that have you ever tested with HIV or any other STIs? Nowadays, because of the increasing trend of human immunodeficiency virus or HIV, we need to be aggressive. And in all patients who are sexually active, we need to introduce HIV or HIV testing. So would you like to be tested? So this is also opportunity to introduce the client kung gusto niya magpa-test on HIV. And if yes, then mas maganda. Then you can schedule it on a different date. And kung meron man, kung gusto niyang magpa-test on other sexually transmitted infection, then you can schedule those tests. Pregnancy. We also ask this because if 25-year-old, going back to the case, 25-year-old man, so definitely if in the coming years, this man will become a father, and we don't want that dream to be halted. So, tatanungin natin siya. Determine if the person wants to be a parent. Are you concerned of getting pregnant or getting your partner pregnant? So, it now, we are now establishing relationship building, and somehow we want that desire of your patient to come true, to be a reality as a father, in the near future, because we know that sexually transmitted infection may eventually lead to complication such as sterility or infertility or even pelvic inflammatory disease. Do you need any information on the birth control? This is also the best time to introduce this information. Kung gusto niya, then we may refer it to other dates, or we can start sharing about the birth control. By the end of the interview session, the patient may have come and realized that all of this may be beneficial to him or to her. And if he or she was not ready to discuss matters, then you can offer that I'll be available in this dates or on this dates, and you can come to the clinic anytime and just let us know when. And what are the other concerns of sexual practices? If the patient or client still want to know more, then write it on a piece of paper. These are the dates available, and my staff are very willing to help you. We should thank the patient for honest answers and the courage to seek consultation. Alam niyo ba, ang lahat ng pasyente coming to our clinics ay minsan it will take days no bago sila pumunta sa amin. Minsan tinatanong ko, kailan mo naisip na pumunta sa clinic? Doc, last week pa. Kaya lang binibuild ko pa yung aking confidence. Una ay alam ko hindi libre. Pangalawa, baka nahihiya din ako about kung ano yung mga sexual practices ko, sexual engagement ko. So makikita natin these patients are trying to prepare themselves when they meet the doctor face to face. So it's very important to acknowledge their courage to seeking consultation. For patient who is at risk of HIV, please take time to educate the patient on the risk of having HIV. Uh, we are now busy about COVID, but we should also be busy about HIV kasi tumataas din siya in other sexually transmitted infections. In summary, sexual history must be done during initial visit, follow-up visit, and even when the patient is presenting signs and symptoms. Kung kailangan gumawa ng sexual history, please do. We need to show respect to all our patients, regardless of gender, sexual behavior, and practices and preference. So wala tayong tinatangi. Always use the 5 Ps, the partners, practices, protection and prevention, pregnancy, and history of the past sexually transmitted infection. We need to incorporate the risk of having other STIs, especially HIV. And lastly, I would emphasize we should not only treat the patient who came into our clinic, but we also do actively contact tracing. And if we find the partner, let's encourage our patient to bring the partner to the clinic so that we can treat both the patient and the partner so that we can prevent further transmission of sexually transmitted infections. Lastly, I would say let us maximize our time on this earth. Let us allow God to make us instruments and vessels of blessings, and let us treat our sexually transmitted infection patients accordingly. Let us be thankful that we are still alive in this time of the COVID-19 pandemic. So with that, to God be the glory. Thank you. And these are the references and the images that we use in this presentation. Maraming pong salamat. God bless us all.